All right, so I'm going to preface this by saying this one's going to be pretty graphic. I'm not talking about like incisions or anything like that. Nothing like that. You're not going to see anything like that. But I'm going to warn you, I am going to show what the Chucks pads look like just 2 hours after wearing them. And I kid you not, before I can get them fully wrapped around me and taped on, they're already saturated. So this is like, honestly, the worst part for me. I was not looking forward to this part again, but it is short-lived, and I know in the end it's going to be so worth it. So I just took off my second foot Chucks pads, and again, that one's not too bad. I must have less drainage on this side. However, earlier you could see, yeah, right there, you can see how saturated my leggings are. So because they did my hip area, gravity is pulling down that drainage all the way down my legs. So literally my thighs are wet, calves are wet, and calves are wet because I had surgery on them today as well. All right, so it looks like my left side is my really bad side, but I've warned you. If you get squeamish, this is your time to just swipe, hit next, close it out, whatever you got to do to avoid this. So this is, I know it looks like a lot of blood. It's not. There is a little bit in there. That's why it's tinged kind of orange. But it's mostly lymphatic fluid, or even more so, the tumescent fluid that they, why can't I think of any words? Probably because I'm on pain meds. That they inject during surgery for numbing, for pain relief, for numbing, okay? I can't find my words, but you feel me. So I know better, and so this time I have brought gloves. I have brought Lysol wipes, and I have brought several garbage bags because in the first 40 or so hours, I'm going to fill those puppies up. So again, this part's a pain, but the disease is a pain. So I am just so excited to be almost on the other side of it. Thanks for following my journey.